We are talking about the tumor of the CNS. In this section, we are talking about the meningioma. The meningioma originates from the dura mater. Meningioma originate from the dura mater of brain and extends into cranial cavity and extends into cranial cavity. Sometime dural tape appearance seen on CT scan. Dural tail appearance. The meningioma are more common in female. They are more common in female. The female to male ratio is 3:2, and they are often associated with the history of neurofibromatosis type 1. The meningioma may be found along any of the external surface of the brain as well as in the ventricular system. They may be found in the ventricular system. Now we are talking the molecular genetics for meningioma. In the meningioma, there is loss of chromosome 22, especially the long arm, that is 22q. The 22q12 regions, there are NF2 genes which are responsible for the synthesis and regulation of protein called myelin. In sporadic cases, 50 to 60% mutation in the NF2 gene occur and there is absence of myelin protein. Meningioma can be occur without NF2 mutation, that are the mutation in the TNF receptor associated factor 7. TNF receptor associated factor 7 in the lower grade of meningioma. In the higher grade of meningioma, NF2 gene mutations occur, and in the lower grade of meningioma, TNF receptor associated factor 7 occur. The morphology of the meningioma is there is round masses with well-defined dural bases, and extensions of these masses into the overlying bone may also occur, and they are spread in sheet-like fashion. They are called end plaques. There is the hyperstatic reactive changes in the adjacent bone are also seen in the morphology of the meningioma. They are also seen numerous calcified samoma bodies on the morphology of meningioma. Mostly the recurrence rate is very low in typical meningioma. Now the atypical meningioma are grade 2 and 4. They have a high grade. they have the higher rate of recurrence and they require radiation therapy, and they in morphology there is clear cell and choroid are also present in the morphology of atypical meningioma. The typical meningioma are slow-growing tumors that arise from the dura mater involvement and they spread over the lateral convexity, and they also spread to the wing of sphenoid, olfactory groove, sella turcica, and foramen magnum. The clinical feature of the meningioma that is predominantly occur in female slightly than male 3:2, and finals for the spinal meningioma the ratio is 10:1. Certain studies suggest that the meningioma express progesterone receptors and may grow more rapidly during the pregnancy.